County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Show, living a longer and healthier life. We're here tonight with Dr. Mikolajczak. Boy, I got that one. Dr.
Nice.
Mikolajczak, it's nice to have you. How are you doing this evening?
I'm doing great. Thanks a lot for having me, Dave.
So you're an orthopedic surgeon, board-certified orthopedic surgeon in the Wellington area the last 24 years. We're going to talk a little bit about your areas of interest, but we're really here to talk about optimal CBD and the benefits and why a physician would be interested in helping, the community out. So why is CBD now physician recommended? How did this come about? And then if on the tail end of that, if you just want to tell us a little bit about, well, actually start, what is CBD? And then how has it become physician recommended?
Right. Okay, great. Again, I'm a board-certified orthopedic surgeon that's been practicing for 20-some years here in Western communities out in Wellington. And the development really of this CBD has been around for 10,000 years. It comes from the hemp plant and it comes from the marijuana plant.
Yeah, I was going to say, where's it been all these years?
Right.
It's been around.
And it was very popular. There's a tremendous history with the utilization of the hemp plant, which is where the CBD basically comes from. And they found historically and most recently the medical benefits, which is really what got me interested in it. 4 or 5 years ago, Sanjay Gupta, who's the medical correspondent for CNN, right? He did a show called Weed One, and he was not a very big proponent of the utilization of marijuana and weed, but there were some growers out in California, and he featured the story on a young girl named Charlotte who had refractory seizure disorder as a 4 or 5 year old girl. She was having 150 seizures.
Horrible.
Week. And medicine just wasn't able to treat her. So they found through some animal studies that it lowers the threshold. And it's pretty dramatic if you get a chance to go to YouTube and look it up to see how the CBD really kind of got launched, I think, in the communities. Or in this country, anyway.
And that's the neurological aspect
right,
of
that's the seizure. That's the seizure effect of CBD, and we have found through a lot of research, and research continues to go on, that there's a number of medicinal benefits to it. And myself, as an orthopedic surgeon, I'm a blessed man to have a great practice and a good following, and I've taken care of a number of people for many, many years, and over the last year or so, I'm seeing patients coming in that are utilizing the application of CBD from topicals to orals to gummy bears to using it as a vapor even. And it's helping a lot of the symptoms that we treat. And as the research continues to develop, number one, the seizure activity has been so profound with children that the FDA produced a drug that just hit the market a couple months ago called Epidiolex, which is actually a CBD-based drug that is used for refractory seizure disorder in children. But again, the number of applications that I've been seeing personally, and really has gained my interest in my practice, is it helps with inflammation. Studies have shown that it works 10 times better than ibuprofen and Aleve.
Oh, wow.
Some people can't take Advil or Aleve. They're allergic to aspirin or the side effects, which all medicines do. It works for inflammation, for pain. One of the big research momentum that's going on is the use of CBD products for pain management. And again, we're in the middle of an opiate crisis, as we all know. The science has found that that molecule of the CBD competes with the opiate receptors in the brain. And actually, they're using it now to treat opiate addiction as a substitute. There's no addiction to it. There's no side effects with it. And so as time has gone on and continues to go on, more and more research being done. And that's something that I'm interested in wanting to do, and doing some clinical studies in my own practice. Because I treat orthopedics, I treat soft tissue injuries, fractures, things with pain, patients with pain, with inflammation. That has been a pretty substantial impact on patients' treatment and improvement of their symptoms. So we're pretty excited about it, and I wanted to really kind of use this venue to try to educate people, because there's a tremendous amount of misinformation out there, as you probably know.
Before that, but let me ask you, let's talk a little bit about Optimal CD. This is the clinic that you've established.
Right.
Correct?
The government has allowed a limit on the amount that we're allowed to have within the hemp and the cannabis plant. And most people have the impression that when you see or hear about hemp or marijuana, that it's the psychoactive part. It's the one that gets you stoned. This is completely different. You can drink, you can smoke as much of this CBD with a very small amount of federally regulated limit of THC, which is 0.3%.
That wouldn't even probably come up on a drug test, right? That's what people are saying?
Yeah, it's a good question. And
it could,
it can.
Oh, it can.
And, people that work, are in workers' comp or, work for certain companies, they can't. But the products that are out there and that we also provide, we can take that small amount of THC away from the molecule, and we call that an isolate. That's the pure form of the CBD, which again is equally as effective. Some of the research shows that a very small amount of THC, not enough to get you psychoactively or high, increases the effectiveness of the CBD product. They actually call that the entourage effect, which is basically a synergy or a symbiotic relationship where the molecule works better on the symptoms that it's being treated.
And what form can that be taken in? There's tinctures, which is under the tongue, right?
Right. The way that it all comes down to how does it get into the body, they call that bioavailability. So the way we use it today for my practice is a topical, either a gel or a lotion, which we provide, or a tincture, which is underneath the tongue. Patients will use either a half of a dropper or a dropper full, and they'll put that under the tongue, they'll let it saturate, and then it gets absorbed. And
a lotion is another way it can be applied as well.
Right. I mean, as people look into the products out there, it's kind of the Wild West. Everybody and their brother seems to have
I've
a
noticed
CBD.
that it's just popped up. It's almost like the .com revolution, but with
it really is amazing.
CBD.
Yeah, it's amazing. I mean, a lot of it's marketing, but one of the things that we did before getting involved in Optimal CBD is we really did, my staff did a lot of research and interviewed a number of companies to find out how they produce it, how they refine it, how do they bring it to the table in an application. And so we found a company, Mile High Labs, it's out in Colorado, that has a proprietary process that basically gives us the best concentration of the product, of the what we call the isolate. And then what we do to secure what we're buying and we're getting involved with is we do what's called third-party testing. In other words, after that product is made, we have an independent lab come in, take that vat or take that
independent lab that has no ties to you, no partnership.
Right.
This is independent.
Right.
I like that concept of it, Dr. Mikolajczak.
Right.
I got it there.
Yeah, Mike's
I'm
fine.
looking at my
I go by
phonetic
Dr.
spelling
Mike.
here.
No, that's
I
right.
was
It's
thrilled.
the one.
Dr. Mike, we're going to say.
Yeah.
But let me just tell everyone while they're following along, it's optimalcbd.com is the website. So type that into your browser. You'll find all the information that we're talking about here. And I just want to mention, because we're getting close to the commercial break, we have a promo this evening for first-time buyers, Dr. Mike, for the isolate and for the free lotion. This is a CBD lotion. So the CBD isolate, which is, and the CBD lotion, $99.99. You'll get both. That's a really good deal to get started with Dr. Mike.
Right, free shipping. We have a website where we can answer any of your questions. And we're continually building on that, where as more information comes to us as scientists and more clinical applications, we're going to share that with the with the public.
That's great. It's optimalcbd.com. That's where you can find a lot of the info as well.
Yeah, optimal-cbd.
Oh, you got to put the dash in there.
Yeah.
Okay, optimal-cbd.com. There's a ton of information there.
Right, we'd love your we'd love to have your feedback, and certainly we'll respond to anyone that communicates with us. Because to me, this is really about the education part of it.
Now, we have about 2 minutes till the break, like I said. Now, CBD can not only help with anti-inflammatory, but can also help with anti-anxiety and anti-nausea. Could you do a minute on each of those?
Right. Those are some of the things that we find, after I operate on a patient, a lot of times they'll have sleep discomfort, muscle spasm. So one of the things that we've seen that has been pretty surprising is that patients' sleep is really improved quite a bit. REM sleep is much better. The quality of their sleep is much better. It helps with anxiety, which is not uncommon in our industry. It's getting people off of the Xanaxes and a lot of the medications that are addictive.
Ambien, Zoloft.
There's a number of them that obviously have serious potential side effects. There is none with the CBD oils and the applications. So we're excited about that. And like I said, I've had blessed to have a great practice and a lot of testimonials from patients that would come in and just report to us from their experiences from family members or whatever, that this is just another means for a lot of their treatment. So didn't want to turn a blind eye to it. We did our research. We looked into a really good product, and we feel, for me, as I say every day, it's another tool in my toolbox.
Yeah, it sounds like you took your time, didn't rush right into it. Dr. Mike, hold that thought. Once again, the promo is first-time buyer. You get the CBD isolate and the CBD lotion, $99.99. It's optimal-cbd.com. On the other side, we'll get into anti-nausea as well, because I want to talk about that and some other benefits on the You and Your Doctor show.
Great.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor show, Living a Longer and Healthier Life. We're here with Dr. Mike, OptimalCBD.com, actually optimal-CBD.com, 561-789-7395, and they got a great promo today. I'll say it a few more times. First-time buyer, you're going to get the CBD isolate, which is sublingual, goes under the tongue, as well as the lotion, which is an optimal CBD broad spectrum for $99.99, optimal-cbd.com. See, I'm learning on the fly like you were saying.
Right, yeah, we'll make you spell it. It's called cannabidiol.
Oh, gosh.
Right. Well, it's from the cannabis
Yeah.
plant, which, again, comes from the hemp plant or the marijuana plant. But, again, not the psychoactive, get you high. And that's something that I think, I'd like to talk about is to the public has to know that when you hear about CBD, a lot of people affiliate that with, you need a license or you need a card. You don't need that with the CBD products that we provide or that are.
Oh, that's a good point because the level's so low of the THC,
Exactly.
like you were saying before.
Exactly. And really, it's the CBD molecule that's really doing the work. It's not the THC, which, again, does have also some clinical applications. But the CBD molecule is really where most of the research is continuing and most of the clinical applications are becoming more, relevant in medicine. Just a number of applications that continue to get used.
Yeah, we were mentioning nausea before the break, mental clarity, and increasing energy as well.
Right. I mean, it helps with anxiety. It work as an antiemetic, which is, again, anti-nausea. Again, as a sleep aid, which is one of the more profound things that we've been able to see with my patients in the clinic. Again, as a first line pain medication. In other words, there's patients that come in, they don't want to get involved in opiates, they don't want to take anti-inflammatory medicine because of some of their side effects. So we're using this and offering it to patients as a first line treatment for their sprains and strains. Post-operatively, I'm recommending it for my surgical patients. And so it's been surprisingly positive in my practice. And as I talk to other physicians, whatever, the other thing is I hear more about is that the veterinarians are using it for their pets. And families, you can buy this application in a pet form.
Recently, that has blown up. I have heard about that.
And again, I'm here. I could give you 2 hours of testimonials from patients and their experiences, but just overall, it works as an anti-arthritic. So you have an old arthritic dog that's a little bit slow. It's amazing how it can perk them up and get them moving.
Yeah, and give them better quality of life.
Right.
You know what I like? What you mentioned is natural versus man-made. So this is from a plant.
Natural.
This is natural.
Yeah, it's one of the oldest
prescriptions are man-made. This is all a bunch of, and it's not good for you over time.
Right. And I think there's some application for it, but again, that's not where my interest is, and that's not where I find the best opportunity to use something that's natural, that's in the environment, and it's 100% safe. No addiction. We really haven't seen any side effects.
Gluten-free, non-GMO.
Gluten-free, non-GMO, and as pure as we can get it. And again, that's where the research, I think, continues to grow, is for getting applications to clinical conditions that we can use it.
Now, before we get into Farm Bill, I want to give out the promo another time. First-time buyers, again, just make sure I'm getting this right. Sublingual CBD isolate, so that's under the tongue.
That's the isolate or the full spectrum. The isolate, again, is the product that has no THC in it. And some people want that. We find that the little bit of THC, which, again, the Farm Bill, that's basically with some of the regulation, has been passed to allow it to be...
I saw that. That was just recently, right?
That was just this year, or this last month, right?
Yeah.
Yeah. And
all 50 states, right?
Right, and actually international. So it's now going to be able to be transported and distributed legally around the country without any issues. That's a very big move on the Department of Agriculture to put that bill to change the laws on that bill.
So people can get the CBD isolate. It's the sublingual under the tongue, and then also the free lotion with it, which is the Optimal CBD Broad Spectrum.
Right.
$99.99. Optimal-CBD.com. Call 561-789-7395 as well. Tell me a little bit about the Optimal CBD Broad Spectrum. When you put CBD as a topical onto the skin, or do you massage it into the muscle where the issue is, or how does that work?
In fact, again, there's different applications for the topical. You can get a balm, you can get a cream, you can get a lotion. Right now, we just started with the lotion. That seems to be the one that's the most popular. And what does it do? It transdermally, it goes through the skin to affect that area that you're being treated. I have some physical therapists that when they come to physical therapy for, we'll say, a shoulder problem, for example, the therapist will rub that into the patient for 4 or 5 minutes. They'll start their workout or start their program, and already the patient has clinical improvement within 5 to 10 minutes, which is something that's desirable. When you're going through a rehab after surgery, or you have a sprain or a strain, putting a topical ointment on, not the biofreeze that's just topical. This is getting into the system. This is getting into the muscle. It's getting into the tissues that need to be treated. And we're seeing that anti-inflammatory effect directly on the tissues, deep to the skin. So
it's a healing effect.
It's absolutely a part of the healing effect. So those are some of the things that we're seeing more and more applications to. And a lot of it's personalized. You may like a balm, I like a lotion, I like a cream. So, if you're going to use this, we'd like to get your feedback on it. If you have some suggestions, go to our, when you're on our website, please give us your feedback. It's going to help us develop, a more broad application and, more focused actually on, what the public needs.
Try optimal-cbd.com out. This is a great time. If people are, they have the pain and their quality of life is affected. For, nowadays, $99 is nothing. It's this is a good deal right now, too. And people can kind of get a taste of it and see if it, works for them. And if it works, it could be life-changing for, a very low cost, which we're all looking for. We got about 2 minutes, Dr. Mike.
Yeah, no, and I think that's a good point where if, people that do their research and you go onto the web and you look up, there's a tremendous amount of misinformation out there. And there's a whole spectrum of costs. You can buy between 100 milligrams to 1,000 or 3,000 milligrams, and it can be very expensive. I've seen products in a small vial for $300-400. We're not really sure what's in there because it's not regulated, and that's one of the concerns that the consumer needs to really be aware of is that because it's not regulated, a lot of it is just marketing. And again, really where you need to be careful on where you're putting your money, because you may not know what you're buying.
Yeah, you want to know what you buy, and you're
Right.
already working with third-party,
Third-party
testing
is
laboratory.
really, I think, a key for that. It costs a little bit more, but we know what we're giving the patient
And that's
when
important.
we're recommending it.
Yeah, objectively. Thank you so much, Dr. Mike, for teaching us about CBD this evening. I really learned a lot. And everyone, check out Dr. Mike. It's optimal-cbd.com. Number's 561-789-7395. Jump on that first-time buyer with the CBD isolate and the CBD broad-spectrum lotion, $99. You can't beat that. It's a brand you can trust, optimal-cbd.com. We'll see you next month, because we're already working on having you back on.
All right. Thank you so much.
Thank you, and thank you, everyone, for viewing and listening.
Thank you.
We had 12 viewers there.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.